Can Medicare Part D coinsurance save you money? Have you ever wondered if Medicare Part D coinsurance can actually help you save money on your prescription drugs? Let's break it down together. Medicare Part D coinsurance means that after you meet your plan's deductible, you pay a percentage of the cost of your medications. The amount you save really depends on a few factors, like what medications you need and how your plan is set up. Medicare Part D plans usually have 3 stages of costs. First, there is the deductible stage where you pay the full price of your medications until you reach a certain amount. In 2025, this deductible can be as high as $590. After you meet this deductible, you enter the initial coverage stage. During this phase, you typically pay 25% coinsurance on covered drugs until your total out-of-pocket spending hits to $1,000. Once you reach that limit, you move into catastrophic coverage, where you pay nothing for covered drugs for the rest of the year. So, how does coinsurance save you money? Well, it allows you to share the cost of your medications with your plan instead of paying the full price. This can be beneficial, especially if you mostly take lower-cost or generic medications. However, if you need high-cost drugs, your out-of-pocket expenses can still add up before you hit that catastrophic coverage. Some Medicare Part D plans offer copayments instead of coinsurance. Copayments are fixed amounts you pay for each drug, which can make it easier to predict your costs. However, they are not always cheaper than coinsurance. It's important to compare different plans to find one that fits your medication needs. There are also additional protections that can help lower your costs. For example, starting in 2025, the Inflation Reduction Act will cap annual out-of-pocket drug costs at $2,000. This means you won't have to worry about the coverage gap or the 5% coinsurance that was previously required during catastrophic coverage. Plus, if you are a low-income individual, you may qualify for extra help, which can reduce your deductibles and coinsurance. In practical terms, if you take mostly lower-cost medications, coinsurance can save you money compared to paying full price. However, if you regularly use high-cost medications, you might find that your expenses are higher until you reach catastrophic coverage. After that point, your costs drop to zero for the rest of the year. To sum it up, Medicare Part D coinsurance can indeed save you money, especially if you choose a plan that aligns with your medication needs and take advantage of the protections available. Understanding your plan's deductible, coinsurance rate, and coverage phases will help you manage your prescription drug spending effectively.